You can start.
So, hello, doctors. Welcome to our Oracle 21 Days Revision Series live class for university exams. Okay, so today we are in Systemic Bacteriology Part 2. So, what are the things we are going to do today is we will be discussing these questions. Okay, one is long questions will be of mycobacteria, that is tuberculosis, and then spirochetes, and then this rickettsia. All are a very, very important topic. Definitely one question from this is sure, 100% guaranteed. Acid first bacilli, that is basically leprosy we're talking, and then vibrio. All are very, very important. Definitely one or two long questions is guaranteed from this topic. And short answers could be a negless, or even it could be in one mark question. You know, it frequently asked. Also, about enterotoxin, azo titer, and normal flora of genitourinary tract and pathogenesis of plague disease. So these are things we're going to discuss. So here, in Oracle, you have all these classes recorded live practical session exam module we have. So we have foundational classes, we have live classes like this, express exam modules, one-to-one doubt clearing section, hard copy note sets, practical sessions, and this is the subscription plan you have. You can choose whatever is right for you, and you can use this code Dr. Santhosh 20 to get more discounts. Okay, now let's start with the question. The first question is define this classify mycobacteria and describe morphology and cultural characteristic of Mycobacterium tuberculosis. So when they say mycobacteria, first of all, mycobacteria, you have to classify them like this. Usually you classify like this. The first one is Mycobacterium tuberculosis complex. That is TB, basically the mycobacteria which causes the TB. Second one is non-tuberculosis mycobacteria. The mycobacteria which is not causing TB but causing other diseases. The last one is your Mycobacterium leprae. That's a separate group, right? That's a separate group. Now here what you do in Mycobacterium TB complex, the organisms are Mycobacterium TB. In exam, you're writing full Mycobacterium, you're right. Okay, I'm writing M for shortcut. There you're going to write everything. Okay. Mycobacterium TB, Mycobacterium africanum, and Mycobacterium bovis. These are the three things in the complex, TB complex. Okay, though TB is more common, but this thing also will come here. These are the important species. In non-tubercle mycobacteria, we have two classification called rapid growers, and then we have non-rapid growers or slow growers. You can say slow growers. Okay, slow growing bacteria. We have mycobacteria. In rapid growers, you have to give few examples. Okay, at least two or three examples is mandatory. So remember Mycobacterium fortitium, okay? Then Mycobacterium smegmatis, and Mycobacterium Mycobacterium. Okay, these are common one. And also one more thing, Mycobacterium abscesses also you can have. Abscesses. Mycobacterium abscesses. Okay, so these are the common ones they have been asking. Yeah, this is you are going to write here. Okay, in slow growers, again, we call slow growers, we classify them into photochromogens, and then we have another one is photochromogen, other one is cotochromogen based on the pigment. Other one is non-photochromogens, okay, or no pigment. They don't produce any pigment at all. Okay, photochromogens, coto, non. So this one usually, there is this shortcut called mask. Photochromogen is called as mask. Okay, mask. So one is your Mycobacterium marinum. It's called swimming pool granuloma. That one more question. A for Asiaticum. S for Mycobacterium simiae. K for Mycobacterium kansasi, which is always like a TB. It looks like a TB. So these photochromogens, they produce pigment in light. In the light, they produce pigment. Okay, pigment in the light. Pigment in the light. Scotochromogen, they produce pigment in both light and in dark. Both in light and dark. Okay, pigment in both light and dark. Non-photochromogen, no pigment at all. They don't produce any pigment at all. Okay, that's it. Scotochromogen, it starts with S only. So Mycobacterium schulgai, and you can add Mycobacterium Jordani. Okay, Mycobacterium Jordani. That's it. Shulgi and Giordani. Non-photochromosome, very, very important, frequently asked question is here. Mycobacterium, avium, intracellulare complex. That's it. Mycobacterium, avium intracellular complex is one frequently asked question. So this is your classification. If you write this one completely, you will get at least 3 or 4 marks for this. Okay. Then rest of the 10-mark question, morphology and cultural characteristics, we are going to talk now. Okay. So this is for your classification. Now we are going to the next one. That is your morphology and cultural characteristics. They directly asked about culture. They didn't have about disease, directly about this thing. So no problem. We can go to the disease. So morphology. When talk the morphology of Mycobacterium tuberculosis, you know that this bacteria usually it has it's we call it as acid fast. No, so first, what are the cell structure? In cell structure, they have something called lipoarabinomannan. Lipoarabinomannan, this is one of the main virulence factor which usually inhibits the phagolysosome fusion. Phagolysosome fusion formation. Okay, phagolysosome formation, that is phagocyte with lysosome fusion is inhibited, and also it has something called cord factor, and very important thing is that it has a mycolic acid, and because of mycolic acid only we put them into which category? Acid fast. That's what we call it as acid fast. It stains acid fast, so we call acid fast bacilli. Okay, so what happened when you're doing a acid fast stain, acid fast, or we call Zn stain, Ziehl-Neelsen stain, you will be getting the bacilli red color, red beaded, irregularly stained bacilli. So this is exactly how it will be. Okay, so it will be like this. If you draw the picture, it will be like this, like this beaded, like this appearance here and there. Okay, irregularly stained, not completely stained. So this is exactly structure of your Mycobacterium tuberculosis. That's it. Okay, just three important structure: lipoarabinol, cord factor, and mycolic acid. So that is what it is, acid fast. So when you're staining, you get red beaded, irregularly stained bacilli. This much only. Okay, fine. Now next is the culture characteristics. When you talk about the culture characteristics of TB, culture characteristics. So first thing is usually Mycobacterium tuberculosis means it affects the lung. So the sample should be the sputum. So we are going to write it like this first. First of all, the sample, and then conventional method, and then we have the latest one is your automated culture. Automated conventional culture method and automated culture method. So these are the things you have tried when they ask about culture of Mycobacterium tuberculosis. So what you're going to say in sample it is sputum, and usually you ask for two samples. You need two samples. One in the on the spot you will collect. Next one is next day early morning sample. Okay, early morning sample, spot sample and early morning sample, you'll get it. Okay, then you have to do what the method is called. There's a method called Petrov's method. Petrov's method is basically what you do. You're going to use sodium hydroxide and naltrate, N-acetylcysteine. Okay, you're going to mix this with the sputum to do basically what? NaOH to cause decontamination to kill all the commensal bacteria in saliva, whatever, because it's nalc is to break all the unnecessary things. So this will cause a de what you call it as a it's like basically to decontamination one. Here it is to cause lice lice of lice of all epithelial and mucous substances. So it breaks all the unwanted cells and mucus, everything, so that you get a clear bacilli. When you're doing staining, you will get very good clear bacilli. Okay, that's the thing. Okay, We call it as also decongestion. We can call it as decongestion. So decontamination and decongestion you're doing. Okay, then conventional culture. The conventional culture, you already know very well. The media name is called LJ media, LJ Media and Dorset's Media. LJ and Dorset's Media, both are important. Both are egg-containing media. Egg media. That is, it's a type of enrichment media. We spoke about it. Enriched media. Sorry, enriched media. So now what happened? The only problem is that these one will takes almost 6 months, it will take a lot of time. It will take a lot of, it will take almost to more than 2 months it will take. Okay. So now sometimes even you can wait. Some of the things are going even more than that. So it will take long time. It take much time. Okay. It takes months to grow. Months. So ideally 6 to 8 weeks, you can say 6 to 8 weeks to grow. Okay. 8 weeks to grow. But in automated culture, you know what is the technique we are using? We are usually using which one? You know very well. That is you're using backtech or backed alert or backed T or midget tube. Midget we call, okay, microbiome growth indicator tube. So this one. So here the growth will be possible within how many? Within 2 weeks is maximum. 1 to 2 weeks, you're ready. It is ready. The colony is seen. Okay. So now what happened here in the conventional method? The colony is called rough, tough, buff colonies. This is the exact word you're going to write. The colony looks rough, tough, and buffed colonies. That's all. Okay. Automated culture, they just write the name, and then this is basically automated. No, but you have special indicators, you'll get it. So I'm giving you basic review how you're going to write the answer. Okay, that's all. This much only. Okay. Now your TB is over. So you have to know TB very well. It's very important. Now spirochetes. When we talk about the spirochetes now, classify spiro is very easy. You know that spirochetes are basically the spiral shaped bacilli. Okay, you can draw the picture. You can say like this. You can draw the picture and say this is a spirochete. They are spiral shaped bacilli. Okay, spiral bacteria with endoflagellate, right? With endoflagellate. You have an endoflagella inside the flagella. The flagella is inside the bacteria. Okay, it's inside endoflagella. Okay, that's what they have corkscrew motility. We're not talking about. We'll stick to the thing. Now, the spirochetes we basically classify, and they're pathogenic to human. Whatever pathogenic they ask. So, first one is the biggest one is Borrelia. Borrelia. Okay, Borrelia. In Borrelia, we have Borrelia Burgdorferi. Very important is the most commonly asked one is Burgdorferi, and of course Borrelia recurrentis and Dotoni are the three important things which is causing diseases because they are pathogen to men. Okay, and then the second one is your Treponema. In Treponema, we have the most common one is Pallidum, which is causing syphilis, Pallidum, and of course we have Endemicum. One more questions they can ask you, and also here you have to write because this is sort of very this thing only Endemicum, and then other one is your Endemicum. Then there is something called Pertuniae, and the other one is keratium. Okay, these are other species. The last one is leptospira. In leptospira, the smallest one is leptospira. This one basically it is the only one species important, interrogans. Okay, interrogans, that's all. Okay, now what are the diseases this is causing? Burgdorferi, it causes Lyme's disease. Recurrentis causes epidemic relapsing fever. Dotonic causes endemic. Yes, endemic. Dotoni, endemic. Okay, endemic relapsing fever. Treponema pallidum causes syphilis. Endemicum causes endemic syphilis. There are some places where syphilis is like endemic. Endemic syphilis, okay. And Pertuni causes a disease called Yas, where your keratium causes pinta. Pinto like carrot, pinta. Okay. Then Leptospira interrogans cause the disease name is Weil's disease. That's it. That's much only. Okay. The rat rodent story. That's all. This you have to this it's for 5 mark. If 10-mark question, this is 5 mark. Easily you'll get it. Just to write the name and the disease pathogen. Okay. Now the next part here will be the lab diagnostic part. Lab diagnosis of your syphilis is very important. Lab diagnosis of syphilis. It's very important for your exam also. So whenever you take lab diagnosis, you classify them into two types first. Okay. First one is called, first one is the first test is usually called as the screening, or they are sensitive tests. Okay. Second part is your specific test. Okay. So here a screening or sensitive test means here you are detecting, you're not here the basically you're detecting the non-specific treponema antibody, and the antigen you're using here, it is called, what it is called, rain antigen. You're using rain antigen. Okay. But here in specific test, what happened, you are detecting the treponema pallidum specific antibody. You're detecting the treponema pallidum itself, specific antibody. And here the antigen we are using is also treponema pallidum antigen. We are using treponema pallidum antigen itself. Okay, that's important. So this sensitive or non-treponemal, this is specific test is a treponemal pallidum specific. This is non-treponemal. This is non-specific. Okay. Here, two important tests you should know. One is your VDRL. Other one is your RPR. So what is the common between these two? Both the tests are slide flocculation test. They are slide flocculation or slide precipitation, slide flocculation test. This you're going to write. Okay. Common. And both are used for prognostic purpose. Both have prognosis. For prognosis after treatment, you will check the titer and say the prognosis whether disease is decreased or not. So for prognosis purpose, you can use both. And what's the difference? The difference is the first one, VDRL, you need microscopy, plus you can detect the neurosyphilis. It is the best for neurosyphilis. This is the best one for neurosyphilis diagnosis. VDRL is the best. Okay, that's it. You need microscopy. For RPR, no need microscopy for RPR. Okay, for RPR, no need microscopy, but and it's not good for not used for neurosyphilis. Because you will not detect it. That's it. Basically, you will not detect it. Okay, that's it. This is the difference between these two. In specific test, you have three important tests you're going to write. What are they? First one is FTA-ABS, fluorescent treponema antibody absorption test. You can say everywhere there is TTT will come, treponema pallidum. So specific, that's what, okay. And second one is your treponema pallidum heme agglutination test, TPHA. And then we have TPI, treponema pallidum immobilization test. And also we have TP, treponema pallidum particulate antigen test, okay, TPPA. So everywhere you see there is a word TP is coming. So that is what it is, very all are specific. So these tests are very specific. The first one is fluorescent based. Here your hemagglutination, so you're checking for the hemagglutination thing. And T for treponema pallidum immobilization, treponema pallidum particulate antigen. I'm not writing the full name because we have to hurry. So just this thing. So this you mention and write which is specific, non-specific. That's all. This is more than enough for you to diagnose a syphilis. That's it. Okay. Now, okay, right. Now next one. So I'm giving the basic things. Whatever I said, you write. With that extra thing you can add from books. You can go through few things and add extra points there. That's it. Okay, that will be more than enough. Now, classify the genus Rickettsia. Classify genus Rickettsia and mention the etiology of typhus fever. Very, very easy question. This is okay. If you confuse also, now you will understand it. Don't worry. So, so here, first of all, the genus Rickettsia. So, Rickettsia, you can classify them into two types. Okay, the first group we call it as the typhus, a typhus group. Okay, and the second group is usually spotted fever. Spotted fever, typhus fever. Oh, sorry. Typhus group, spotted fever group. Okay. So in the rickettsia, what happened? Some disease, there will be more typhus fever will be there. There will be typhus fever. So here what happened in this case, your fever will be more than the rash. But here in spotted fever, the rashes will be more than the fever. But both will be there, but both will be more. That's all. Okay. So now in all these diseases, the important thing is that you have to talk about the first thing in every disease, you have to talk about the uh, etiology agent. Let's write like this first. First, you're going to mention the disease. Okay, disease, whatever the disease it's causing. Then the etiology agent, and then the vector, and the wheel flicks next. Okay, we will tell the wheel flicks next. Okay, now first one. Let's go like this. I think I can add wheel flicks also in the side, so it'll be everything will be covered in one place. No, just a second. Okay. Hmm. Here, the last column we'll put it for wheel flicks. Wheel flicks reaction I'll talk in a while, but then first we'll mention these things only here. Okay. So in typhus group, first one, the first one disease when you talk. Here the disease under these things are first one is it's a epidemic typhus, endemic typhus, scrub typhus. Okay, spotted fever. In spotted fever, you will be classifying it as your first one is your Indian. First, we'll go with the Rocky Mountain fever. It's better. Rocky Mountain fever. Disease name is Rocky Mountain fever. Indian tick typhus. The name itself it has tick typhus. Indian tick typhus. The third one, rickettsia pox. That's all. Okay, list the disease. Very good. You will this is the physic exams will be very happy. Then what you're going to write etiology. Talk about etiology. Typhus, you know that it is caused by rickettsia. I'm sorry. Prava Saki. Rickettsia Pravasaki. Okay, epidemic. Endemic, it is rickettsia typhi itself. Rickettsia typhi itself. Easy. Scrub typhus, this is usually, it is called Susuga mushi, Orientia rickettsia, but usually you say Orientia, Susu, T is silent, Susuga mushi, Susuga mushi, okay, Susu, SS is there, Susu, that also you can remember, okay, you can remember different ways we can say. Okay, now, yes, now next one is, vector. For epidemic, always whenever there is epidemic word comes, louse is the right answer. Louse. Okay. And here for typhi, it is flea. Endemic, it is flea. Endemic is small area, flea. Big area, louse. Large area, louse. LL. You remember like that. Large, louse. Flea, small. Okay. Susugamusi, here it is your mite. It will be the mite. Especially larva of the mite, we call larva of the mite. Okay. Larva of the mite. That one. Whale flicks, will come to whale flicks. Rocky Mountain fever, the organism called, if your people usually say when you go on a Rocky Mountain, you will be saying rickettsia, rickettsia. You'll be saying it twice. So it's rickettsia, rickettsia. Okay. Indian tick typhus, it is usually caused by rickettsia conori. Conori. Okay. And rickettsia pox, rickettsia acari. Okay. This you have to remember. Then rickettsia, Rocky Mountain, you will do tick, tick. Tick, conori also tick, tick. And Akari would be, Akari will come, Akari is mite. Again, it will be mite. Okay, mite. Okay. This all are the common thing. Disease, name, etiologist. Now, whale flix reaction. In whale flix reaction, you should know that very important here. Whale flix for epidemic and endemic typhus, it will be OX 19. Only OX 19 is positive. For scrub typhus, OXK is positive. If you forget also, scrub, no, SK or UB, scrub. SC, you make it as K. So K positive. And whereas these two, for Rocky Mountain Indian, it is OX 19 and 2 positive. 2 will come here also. Here, nothing. All negative. Here, all negative. This is the whale felix here. Okay, this one you're going to write. Okay, then after this, I'm going to the next one now. Wheel-Felix reaction. So when they ask detailed Wheel-Felix reaction, it means examiner expect you to write everything about this. So Wheel-Felix test we just told. So what's the Wheel-Felix? Wheel-Felix test is basically, if you remember, it is a heterophile agglutination test. Heterophile agglutination test, like your Paul Bunel test, your CAT test in Mycoplasma, Paul Bunel, Epstein-Barr virus. So this is also heterophile agglutination test. Okay. So here what happened? You're using Proteus antigens. You're using Proteus family antigens. Which one? You're using Proteus vulgaris and Proteus mirabilis. You're using Proteus vulgaris 19 and 2 antigen and mirabilis OXK antigen. You're using this one to detect which one? To detect the like a cross antibodies, no, to detect the rickettsial antibody, to detect the rickettsial antibodies. Okay, and that's what we just put. And interpretation we already spoke before. Interpretation just we won't write it again, because for epidemic typhus and endemic typhus we spoke only OX19 is positive. Only OX19 is positive. For scrub it is, for scrub typhus it is OX-K positive, right? Whereas Rocky Mountain fever and your Indian typhus, it is both OX19 and OX2 positive, whereas for your rickettsia pox, all negative. That's it. Okay, this much only. Very simple. So you give interpretation, 5 mark for this, easily to score. So there is no any point that you're going to make mistake in this question. Okay, that's all. So done now. I hope it's clear now. Now we're going to the next one. List the acid fast base layer and the classify leprosy. Very easy question, not that difficult. Okay. So now here, if you see, yeah, I might have to hurry. So first of all, acid fast bacilli. When you talk about the acid fast bacilli, we just put whenever there is mycolic acid, then that will be this thing. Because of mycolic acid. So what are the acid fast bacilli? We know the first one is Mycobacterium tuberculosis, then Mycobacterium leprae, and of course we have sorry, nocardia. Rest all are parasites. Parasites we're not talking. That acid fast parasite will talk acid fast topic. So these Mycobacterium TB, leprae, and nocardia, and one of the Legionella species, but that not that much as. So here what happened, only thing is that for Mycobacterium TB, you are using 25% H2SO4. For leprae, using 5% H2SO4. Nocardia, 1% H2SO4. That's it. These are the 4 commonly known acid fast bacilli. Okay. For Legionella, also one more Mycardiae, Legionella Mycardiae, but not that. These 3 are very, very important. If you remember this, more than enough. Okay, fine. Now, classification of the leprosy. So I'm going to down only. So when you talk about classification of leprosy, Mycobacterium leprae. So here we classify them into, what are the types? Reynolds classification. No, you have so many different type of classification. So basic common classification which we're using here is your TT type, BT, tuberculoid type, borderline type, borderline tuberculoid, BB, and then you have borderline lepromatous and totally lepromatous, LL type. Okay, that is TT, BT, BB, ML, LT. So BT is most common in India. Now, when compared to TT and LL, you should write some important points here definitely. For TT, it's paucibacillary. And slowly it will increase. In LL, it is multibacillary. Everywhere it just increases and go, okay, multibacillary. And then TT, cell-mediated immunity is high. Then it will decrease. Here it is low. Basically, immunity is low in the LR type. Only thing is that lesions are less here. Lesions are less. In TT, you will have very hypopigmented rash. But here in the lesions, like you will almost have what different like nodular things. You'll see nodules and all will be there. So they all will be high, more nodules will be there. That's what happened because of CMI is high. Here, lepromin test is positive. Lepromin test comes positive. Here it will be negative. When you go slowly it starts to decrease, and in LL form it becomes negative. That's all. This is the thing. So when you say nodule gudule, here in LL they have what typical lion face, saddle nose, all the typical features. Okay, and the hands, skin sensation lost, cold sensation lost. So all the typical symptoms will be there. Okay, so these are the things when talk classification. You're going to write all these things. That's all. Then lab diagnosis. Now for lab diagnosis for mycobacterium leprae. So we put into two. One is your stain, acid fast stain. Other one is your culture. Okay. In acid fast stain, you know that we are using, that is in Zn stain only, we are using 5% H2SO4, 5% H2SO4. And then what happened? You will see typical this appearance, the picture I've written back, you can see all these things. So they are like typical globe, or you call it as, I'm sorry. So when you use this, you will call what the typical globe or cigar bundle appearance. This word is simple, cigar bundle appearance. You can see. Sometimes they call it as fight for a technique also. You don't need to write this one. The globe or cigar bundle appearance, acid first bacilli appearance, bacilli are seen. Okay, that's it. This is for your leprae. Culture, no artificial culture. We don't have any artificial culture media. Only animal, artificial culture, no artificial culture media. So you're using two animals. What are the two animals? One is the nine-banded armadillo. Nine-banded, the picture is here. If you see this picture, what I've written here, this is the one. Okay, nine-banded armadillo. And then nine-banded armadillo. Second one, food pad of mice. Food pad of mice. So these are the two places where your thing will grow. Leprosy will grow. Microbiome leprae. Okay, this is that. Then one more test is a lepramin test. Ideally, they ask lab diagnosis. Lepramin is basically clinical diagnosis. Okay, yeah, but if you add, it could be 1 or 2 marks extra. Examiners can give you. I'm sorry, lepramin test. It's a type 4 hypersensitivity reaction skin test. So basically you have an early reaction and late reaction, early and late. Early you read within 48 hours. Late will take 21 days. It will take, okay. So early and late. So this early one, you call it as Fernandez. Fernandez. E and F. L will come late. So it is Mitsuda. Here you see the erythema. If you see erythema, it is positive. Here you see nodule, it is positive. That's it. So lepromin test. This much only. Very, very simple, easy. You can explain all in full detail, but this point, whatever I mentioned, definitely should be there in your exam. You have to write, okay? And this picture also, make sure you're drawing this picture, not the armadillo, at least this one, this acid first basically, you're going to write it. Okay, that's all. So now next one is your cholera. Another the big question, cholera. Cholera is very, very easy. Definitely, it's not that difficult. So I will talk about that. So classify Vibrio. Vibrio, you classify Vibrio usually classified into basically, basically we classify them into two groups. One is Vibrio cholerae, okay, and other one is halophilic Vibrio. Halophilic Vibrio. Okay, so in halophilic Vibrio, you have the organisms called Vibrio parahemolyticus, Vibrio alginolyticus, and Vibrio vulnificans. Okay, that's it. Now, Vibrio cholera is very important. We are interested in Vibrio cholera only, very important. So, Vibrio cholera, cholera classification morphology is very important. First of all, Vibrio cholera classification. Here, this, how do you classify? You classify into two things. They are basically called the O1 and non-O1. Okay, non-O1 type. This O1 type again classified into two things. If you remember, usually we call it as classic and Altor. Classic and Altor type. Okay, classic and Altor. Again, I'm sorry. Mm. Again, classic and Altor type. Again, this both of these are biotypes. These two are biotypes. Biotypes. Then under this there will be serotypes. No, serotype is common. Serotype you call it as like this: Igawa, Inaba, Hiko, Jima. It's during outbreak, it's very important, this classification. Otherwise, it's not much. Okay. But important is again for us the morphology. Morphology, yes, definitely you have to draw a picture of the Vibrio because it's very unique. It's like this, a slender like this with a unipolar. Okay. So you're going to write this is a flagella. So you're going to write it is a slender comma shape bacilli, slender comma-shaped bacilli, unipolar nuclei. They have only single nucleus. Unipolar flagella, sorry, unipolar not nuclei, flagella. And with this, what motility they have? Frequently asked question is your shooting star motility. Okay, so they have the shooting star or darting motility. This is the one what they are expecting, darting motility. These two words definitely you have to produce for morphology. Okay, unipolar flagella, shooting star, darting motility, thin unipolar. They're very slender, commercial basically unipolar flagella, shooting darting motility. That's it. Now pathogenesis, lab diagnosis and pathogenesis. Now go pathogenesis. Pathogenesis is very simple, not a big deal. Pathogenesis. I'll go step by step. So how it happens? First of all, fecal oral route. Basically, it's the water. Usually, it is the contaminated water. Then stomach, especially when you have where achlorhydria, when there is achlorhydria because of because of because of using antacids or PPI inhibitors. So if there's achlorhydria, the load is you can have. So infective dose, it is more than 10 to the power 6 bacilli per ml of water. Okay, 10 to the power 6. This is important question. Then it bypasses the stomach when there is achlorhydria. Then if go to the intestine. In intestine, we know that its favorite cell is GM. This is we are talking about a vibrio toxin, which has two sides, B and A. So the B side binds the GM1 receptor, ganglioside receptor. Then what happened? The mechanism, we frequently spoke about it. Cyclic AMP, C for cholera, remember like that, na? Or adenylate cyclase pathway. They do this pathway. Then they open, because it's activation, there will be opening of the channels, opening of the pore, this basically iron channel, pore channels will be opened. And then what happened when it's open? All the electrolytes and water goes into the lumen. And when they go to the lumen, they manifest as what stool? You know very well, rice water stool, rice water diarrhea. That's what in cholera, we call it as rice water diarrhea. Very, very simple. You got it? Very simple. This itself will give you 2 or 3 marks. Easily you will score. For 10-mark question, the pathogens, if you write like this and step by step, examiner should be very happy and they'll give you full mark. That's what child get dehydration. So pour water and electrolyte, everything will be good. There's no inflammation. Okay, non-inflammatory rice water stool diarrhea. Non-inflammatory. I'm going to write here non-inflammatory rice waters. You never saw any inflammatory here, right? Everything is just channel open. I think it's going on. That's all. Okay. Now the lab diagnosis. Lab diagnosis is very important. This lab diagnosis alone can be also 10-mark question. So in lab diagnosis, the first thing what you're going to do is that you do a wet mount. That's already we spoke. In wet mount, you will be checking for stool wet mount. If it's stool wet mount, diarrhea wet mount, if you do, you look for what? Darting motility. Then what you do, you put culture. So you send it through the transport media. Transport media, we already spoke many times previously also. So I'm going to very fast. you're using Venkataraman Ramakrishnan media or Carib layer media, or you're using autoclaved seawater, okay, seawater, salt water or seawater, they all same only, autoclaved salt water, seawater. Okay, then next one, transport media, and after that you have to do enrichment. No, enrichment. For enrichment, we always speak this frequently. We have enrichment and then also select. I'm going to write everything here so that be easier. Selective media. Okay, so for enrichment media, we know we use alkaline peptone water. Alkaline peptone water. Everything is important. You have question on this, either 10 mark, 5 mark, or objective. Definitely you will be having. For selective media, we know that is your thiosulfate citrate, bile salt agar, or bile salt agar itself, bile salt agar. Okay, these are selective medias, alkaline peptone water. Name I'm not writing full, you will learn. Okay, so this is basic revision session now, no? So we're going fast. So apart from that, now you're going to do biochemical test. The third one is your biochemical test. When you do biochemical test, there's some test called string test. You will have something called string. String test is basically you mix the colony with the bile, and if you try to lift it up, you'll see a string-like thing. I'll show you the picture. String test and nitro red test. Nitro red is basically it is just nitrate will be reduced. That's it. Okay, that only you'll see. Nitro test, you call nitro red test. So many names are there. Nitro red test, red reaction, nitro red reaction, whatever you can say. Okay, reaction. So that mainly I need you to remember the string test. It's very, very, very important. Okay, that's all. So now you see the picture. This is what I'm talking. So this is the first picture. It's a TCBS media. And then the one here, this is string test. You mix with the thing and you try to pick it up. You'll see this. And this is your TCBS, thiosulfate citrate bile salt agar media. Okay, that's all. Just very, very simple. We are done with this. Now we are going to the small questions. Very, very easy questions, not a big deal, very easy to score, you know very well. Okay, now what we're going to do here, look at Naegler's reaction is basically neutralization reaction. Neutralization test is usually done for which species? Clostridium perfringens, to differentiate Clostridium perfringens only. Perfringens. Okay, yes. Now it is used to detect basically the alpha toxin, which is specific for Clostridium perfringens, otherwise called lecithinase. Lecithinase activity. So what you have to do is to detect. Now procedure or method. The method, what you do, you use the egg yolk agar. You use egg yolk agar. One side with alpha anti-alpha, one side no. One side you do, one side no antitoxin, one side with antitoxin. Okay, so you in egg yolk agar, you're going to use both the you're going to use antitoxin, you're going to use antitoxin and no antitoxin. Okay, two sides, antitoxin and antitoxin. So when you streak on that on egg yolk agar, so on the antitoxin side, no reaction, no any reaction. But when there is no antitoxin, you will see an opalescence, around colony. You will see an opalescence. This is the one. Opalescence around the colony. So when you see opalescence around the colony egg yolk agar, that means it's positive. That's it. Okay. So these are the points you're going to write, and full 5 mark easily. You can draw this picture also. You see here, because there is an alpha antitoxin is there, so there is no any opalescence. Here there is no any antitoxin. That means the lecithinase makes the action. What action it produces? It produces this reaction called opalescence around the colony. So when you have like this, then that is positive. This is a neutralization. So everything is a question here. Okay, nothing you can leave. It's a neutral N for a neutralization. For Clostridium perfringens, we do to detect alpha toxin or less. They're same only. They are same meaning. Lecithinase enzyme, alpha toxin same. That's all. This is an easy question. So 5 mark is like very easy to score. Yeah. Now next is your enterotoxin. We talk about enterotoxin. Enterotoxin. What are the points you're going? First of all, this is a type of, they are the type of this type of exotoxin, not endotoxin, exotoxin. And these toxins, they act in the GIT. They act in GIT tract. Okay, GIT tract. Now the examples. When they ask about the examples, you should give few examples, at least like cholera toxin, G8, cholera toxin, Shigella toxin, cholera, Shigella, even your Salmonella toxin. And you can mention in gram positive your Staphylococcus, enterotoxin, A, B, many things are there, except F, many things are there. At least A, B you can mention. A is most common. Okay. And then, of course, your Clostridium difficile. After antibiotic, you get no. So those toxins are what? Enterotoxins. So they have different mechanisms. You know that the cholera toxin which I spoke acts to G1, GM ganglioside GM1 receptor. It acts to this receptor. Whereas Shigella toxin acts through, we spoke many times that it acts to M cell. Here also Salmon also through M cell, and then different mechanism. It's going to act through the cyclic AMP mechanism, where your Shigella toxin going to inhibit the 60S unit. We spoke about it. Salmonella, nothing specific. It's basically bacteremia. Here also enterotoxin, they act through the acetylcholine vagus nerve stimulation. Clostridium difficile also acts on the chip. So this is just write the examples. So these are the toxin acts in the GIT, and they cause different, usually they end up in the diarrhea or other vomiting symptoms or whatever. That's it. These are the enterotoxins. Okay. And I always say exotoxins, but they're heat labile. It can be heat labile or heat stable. Okay. Heat labile. Usually heat labile. Okay. Heat labile. Some of them are heat stable also, but mostly heat labile toxins, exotoxins, or you know that one. Okay. So these are the few examples. Even you can add your E. coli toxin also, right? Even you can add the Escherichia coli. It has both. It has, if you remember, it has a heat stable and heat labile. So different mechanisms. Okay, heat stable and the heat labile toxins. Accordingly, they will work. That's it. This is for your enterotoxin. Type of exotoxins act in the GIT and causes diarrhea and vomiting symptoms, and mention all these things. That's it. Okay, simple. Okay, next. Hmm, Missed ASO test. Yeah, ASO test. What is an ASO test means? ASO is basically, it is an anti-streptolysin O titer test. This is for this is formed again antibody. This is formed against which bacteria? Your Streptococcus pyogenes, or we call it as group A streptococcus. Okay, so this helps in what? This ASO usually helps in diagnosis of, it helps in the diagnosis of two things. One is your throat streptococcus. I'm going to write here. One is for your streptococcal pharyngitis, this group A pharyngitis, and other one is rheumatic fever, also caused by this, rheumatic fever. Mostly then followed by post-operative glomerular nephritis, but mainly rheumatic fever. Okay, if you remember, it comes under this Jones criteria. Jones criteria, you can see this is one of the essential criteria. Okay, so you do this titer. So now interpretation, what happened after doing this anti-estros titer comes positive. If it is more than 200, if a titer value is more than 200, it is considered positive. It becomes positive. That's all. Okay. So anti-streptolysin O titer test, we detects against Streptococcus pyogenes, antibody against this one. So this if this is raised, if the anti-ASO titer is more than 200, it's positive. What positive? Either patient is having Streptococcus pharyngitis or rheumatic fever or post-operative glomerulitis. That's it. This much. Very simple. Okay. This is for ASO titer. And we have for post-operative glomerulitis, we have DNAs, anti-DNAs titer. That's different. So here only this one. That's it. Okay. So now next one. We're almost finishing now. Normal flora GIT. Genitourinary tract, normal floras can be classified into. You can classify them as aerobes and anaerobe. It will be very easy. Aerobe and anaerobe. So genitourinary is mainly female we are talking. Now genitourinary male also, but female has very important significance. So what are the important things there we have? It includes the, let's start, lactobacilli. The good ones, lactobacilli. Of course, we have staphylococcus also. In staphylococcus, both epidermidis more common, followed by aureus, Staph aureus. And then, of course, Streptococcus. Streptococcus, anything. The Streptococcus species, Agalactia viridans, anything can be. Okay, that also seen. And lot of diphtheria. Not the diphtheria throat one, the diphtheroid, other diphtherias. Okay, DFHT, diphtherias. They're all normal floras, okay? Diphtheria. And of course, don't forget Candida. Candida, very common, is in yeast, is very common. Also, your Gardnerella, which causes bacterial vaginosis, also can be normal flora. Yes, the balance goes, no, that's what you get by vaginosis. And one more thing you can add is you can add your mycoplasma. Mycoplasma. Also, these are common ones there. And anaerobic, usually you can see Bacteroides, Fusobacterium, and even this streptococcus, but peptostreptococcus. Okay, so that is also anaerobe you can see. So these are the common anaerobes you can see in the female. So this much you right. At least we mentioned 10 bacteria, easily you'll get 5 marks. Definitely they'll give you. That's this is the normal floras, right? Now, next question. Pathogenesis of plague. So plague, you know that first of all, plague, the causative agent, the reservoir. Usually, when you talk, the reservoir is usually the rodents, the rats, and transmitted by, and it is transmitted by the vector that is your rat flea, commonly known. That is your rat flea. So what happened when and then what happened? The bacteria which is, I'm sorry, so this should be here. Yes. Now the bacteria which is causing this is your which one? Yersinia pestis. Yersinia pestis. The most important virulent factor here is capsule which is called F1 antigen. F1 antigen capsule is the main virulence factor here. With this, plus they also your lipopolysaccharide and other layers, cell wall layers, whatever is there, phospholipase, etc., etc. They are also important virulence factor. So what happens in pathogenesis? Usually, the first one after this this flea bite, rat flea bite, then what happened? This bacteria, Yersinia pestis bacteria, goes to the blood. From the blood, it goes and reaches the lymph nodes. Okay, goes to the lymph node. It reaches the lymph node. When it goes to the lymph node, okay, and then from lymph node again, what happened? It can go again to the blood once again, and it can affect either the lung or spread to spread to different sites. Okay, metastasis sort of. Okay, lung. So now when it goes to the lymph node, you call it as bubonic plague. There will be swelling of the lymph nodes, will be swollen. That's called bubonic, which is the most common manifestation. But again, if it is severe and spreads over, goes to the lung, you will be getting pneumonic plague. And the more worst, when it go to the peripheral tissue, different type, it causes gangrene. That is, it becomes sepsis. So that is gangrene. That is basically called septicemic plague, which is the most dangerous one. That's what we call it as the Black Death. Black Death. Okay, that's all. This much only. Very simple. Yersinia bacteria, where it goes, travel to lymph node first, and then blood, gun, etc., and you get it. That's all. This much only. Very simple for a pathogenesis of plague. If you write this easily, 5 marks, so definitely they have to, at least 4 marks, so they have to give. Okay, some people don't. Okay, so that's all. So we are done for today. The topics are very easy. So you have to just get this from this part. Definitely you'll have 2 or 3 questions easily comes. So make thorough with this topic. Okay, so that's for today. Thank you.
Thank you, sir.
Yes, Sandeep.
Thank you, sir.